Health and Human Services Secretary Robert F. Kennedy Jr. wants the Centers for Disease Control and Prevention to stop recommending fluoride in America's drinking water. On Monday, Kennedy praised Utah for becoming the first state to ban fluoride in the water supply and said he hopes other states follow suit. The Environmental Protection Agency also said it would work with the HHS to review the effects of fluoride. Now, Kennedy has made multiple claims about fluoride being linked to several health issues, but many experts say it is safe and has proven benefits for dental health. CBS News medical contributor Dr. Celine Gounder joins us now. She's also editor-at-large for public health at KFF Health News. So, Doctor, thank you for joining us on this. Why was fluoride added to the water in the first place, and does it still matter today?
So this was something that was observed in the early 1900s, that communities where there was naturally occurring fluoride, those communities had lower rates of dental issues, lower rates of cavities. And yes, it does still matter today, even with having fluoride in the toothpaste, mouthwashes with fluoride. Even with that, we see a 25% reduction in risk of cavities among both adults and children if they have fluoride in the water. 75 million Americans do not have dental insurance. And if you're a child in a lower income family, you are at 3 times higher risk of having dental issues. So this is both a health issue as well as an economic issue.
Is there science that supports Secretary Kennedy's concerns?
Well, there was a report that came out last summer from the National Toxicology Program, which had some questions about depending on what level of fluoride you're looking at. And that's the science he's asking be reviewed or reviewed in more detail. And I think it's really important to understand dose is everything here. So the CDC recommends adding fluoride up to a concentration of 0.7 milligrams per liter. Then you have the EPA that sets a legally enforceable limit of 2 milligrams. And then, 4 milligrams. And then there's this question of about 1.5, 2, is that level safe or not? And so you have different agencies that have control over this. The CDC is recommending addition of fluoride up to 0.7. The EPA right now will tell your local jurisdiction you have an issue if you have more than 4. Will that level come down to, say, 2 or 1.5 based on that re-review of the data? Perhaps. But the levels that we are adding fluoride to in the drinking water are known to be safe, and they are known to be protective.
Does the Secretary have the authority to ban this?
He does not have the authority to ban this. He has the authority, because he has authority over CDC, to pull back on the CDC recommendation to add fluoride up to that level of 0.7 if it's not already naturally occurring at that level. And then the EPA can change the maximum level, which is legally enforceable, unlike the CDC recommendation. And so that's why it's really significant that the EPA Administrator Lee Zeldin was side by side with RFK in Utah praising the state for their ban on fluoride, because if real action comes, it'll really be from the EPA.
Okay. And while this is all grabbing headlines, we know lead in drinking water poses a real danger as well. What is the administration doing about that?
Well, unlike fluoride, where a low level of fluoride is protective and beneficial, high level of fluoride might be concerning. Lead, there is no safe level. There is no beneficial level of fluoride. And so last fall, the EPA finalized a rule about lead pipes going to homes. There are still 9 million homes in this country that are affected by having lead pipes. And the EPA has mandated that those be switched out so that children and others are not being exposed to lead through the drinking water.
All right, Dr. Celine Gounder, thank you.